you are working in accidental emergency department. One patient came by accident with multiple injuries. So how you are going to treat that patient? What are the things we have to do? So in this video we are discussing these things. So please grab one paper and let's move forward. So causes, what are the causes can cause this traumatic conditions? Means high energy trauma, like for example MVC or fall from height, or maybe some associated with spinal injuries, or some life-threatening conditions. Life-threatening conditions or visceral injuries. If any person is fall from height, mostly that spinal injuries and some life-threatening conditions, visceral injuries or cardiac tamponade, or this type of accidents we can see in accidental emergency department. Okay, so mostly what are the things we can see when patient came to you? What are the clinical features we can see? First one, some local swelling, tenderness, some, if any fractures means deformity of the limbs or extremities, and some old people we can see instability of the pelvis or spine. And we can see like some that loss of consciousness will decrease, and hypotension because of hemorrhage, and hypovolemia also. So these are the things mostly we can see, and sometimes involvement ETOH or some other substances. So okay, so now we saw the clinical features. So when patient came, what are the things first we have to do? We have to do investigation. In investigation, if patient have like any spinal related problems or fracture, that time directly we have to jump to like trauma survey. Trauma survey means I will tell that management treatment plan, how we have to do that thing, but before you have to know the basic. That's why I'm explaining these things. Okay, so in an investigation we have to do trauma survey, and then after X-ray imaging. In X-ray imaging we can see lateral cervical spine, anterior posterior chest, AP pelvis, and AP and lateral view of all bones injured. Okay, and maybe sometimes if we have getting doubt, because maybe internal some musculoskeletal injuries or like pelvis or some smooth muscle type injuries, that time we have to do CT. In CT scan we can inspect for musculoskeletal injuries, or otherwise some views of pelvis we can use like anterior posterior inlet and out pelvic inlet and outlet, and acetobular fractures. These things we can see in through imaging. Okay, so now main thing, if any patient came to you in accidental emergency department, that time we have to start management. In this management, first we have to do primary survey. So what are the things will comes in primary survey means, first we have to think about that patient is life threatening condition, so that time we have to react fast. So we have to follow one mnemonic. We have one mnemonic, that mnemonic we call A B C D E. Okay, I think you already know these things, but I'm going little deep in this topic. So A means airway. In airway, mostly if this is life threatening condition and trauma patient, like high energy trauma, so maybe that spinal cervical region, spinal cord will have some problem with like fractures and these things. So that time always, if any patient coming with trauma, means we have to use C spine protection, then only we have to check airway. Okay, then after we have to assess airway opening, and we have to check patient can speak or not. Okay, then next we have to check for any obstruction are there in auscultation or stridor, hoarseness voice, and we have to check Glasgow Coma Scale. If less than 8, we have to react fast. So in actions, what are the things we have to do? First, we have to put the patient in jaw thrust but not head tilt. If any secretions we are seeing in oral cavity, then we have to do suction, and we have to check oropharyngeal and nasopharyngeal airway. Then after endotracheal tube, or for actions based on conditions, I'm telling these things. Or cricothyrotomy we can do if intubation is failed, and always we have to maintain cervical spine immobilization, because if mobilized means that spine or the spinal cord can get breakdown or fracture these things, because already that cervical side it's totally fractured. Okay, so we have to always think about immobilization. So next thing we are going to do, we are going to check breathing. A means airway already we discussed. Now breathing. In breathing, mostly we have to start with chest rise, and breath sounds are coming or not, and we have to check oxygen saturation and respiratory rate, and we have to always look for tension pneumothorax in trauma patient, because this is the most common conditions, or open pneumothorax, a flail chest, or massive hemothorax. So in actions, what are the things we have to do? In trauma patients, we have to give oxygen 15 liters per minute. Okay, and we have to start chest decompression. For chest decompression, we have to do needle thoracostomy, and chest tube. If patient is apneic, bag, valve, mask, ventilation we can provide. Okay, so next we are discussing about circulation. In circulation we have to control the hemorrhage, because it can leads to hypovolemic shock. Okay, next, how we can assess? We have to based on pulse, blood pressure, skin color, capillary filling time, and mental status, altered mental status. Okay, so if patient have getting bleeding from, like we are seeing external bleeding, what we have to do? If you are seeing external bleeding, directly we have to apply some direct pressure to stop that bleeding. Next, we have to do tourniquet or balloon tamponade in if that artery or vein rupture means we have to do tamponade. Okay, balloon tamponade or Foley's we have to use. Next, IV access. In IV access we have to do two large bore, like 15 gauge large bore we have to use for draw blood, and we have to give some fluids like crystalloids, isotonic crystalloids we have to give like 1 to 2 liters. After giving fluids also, if patient is not responding means, then after we have to give plasma red blood cells. Okay, then after we have to consider that fast exam for internal bleeding. Fast exam means we have to check with ultrasound. Okay, next we are going to see the D. D means disability. What is disability? Disability means we are checking neurostatus, that means neurological, any brain related any hemorrhage and these things are there or not, any neuro related things. Okay, so what in disability what we are going to check means, first GCS, Glasgow Coma Scale, this 15 by 15 or less than 8 we have to check. Next, pupil. In pupils mostly we are see the size and it's reacting with the light exposure or not. Next one, we have to check for lateralizing signs or posturing. Next we have to check blood glucose. In blood glucose, hypoglycemia, mimics like trauma. That means in trauma patient, how that neurological things we can, neurological status, what are the things we can see, it will comes in hypoglycemia. Okay, next, E means exposure. So what are the things will comes in exposure means, if any patient, like we have to, like exposure means some toxic material, that patient is attacked with any toxic things, and we have to cut the cloth and we have to send for toxicology, and we have to check for hidden injuries. Why you have to check for hidden injuries means, one okay, when I'm in accidental emergency department, that time one patient came with car accident. Okay, that patient in lying on bed, we told that patient don't move, but he don't want to listen because he already drank little, so he's not at all listening. Then after we have to do CT scan, but it's already, that CT scan things already filled with patients, so appointments. So what we did, we told him to just wait here. He get up and he told like I want to go urine. So he get up and he went inside, then he fall down. Then after we realized when we did when the doctors took him to surgery, that time we saw he have splenic artery rupture. That means that's that okay, if any patient getting car accident means mostly they will get spleen rupture, okay, hemorrhage. So there that person have hemorrhage, and then after we did management. But mostly if any patient have hemorrhage inside means mostly that patient we can't see with our naked eyes. We have to do some CT scan or we have to check in physical examination. Okay, so always we have to think about hidden injuries. And next, prevent hypothermia. How? With the warm blankets, with fluid warmer. Okay, so guys, this is the ABCD approach how we have to do the things. Okay, so now this things will comes in management. So when patient coming to you, you don't have to check everything. First we have to start with this primary survey management. Okay, then after we have to go to secondary survey. What's the secondary survey means? We have to check the patient head to toe exam. After doing this primary assessment, we have to go to head to toe exam, plus history also we have to collect from. If patient is conscious, we have to take from patient. If patient is not conscious, we have to ask from the guardians or someone who came with them. Okay, then after, mostly in secondary survey, it's not like we have to follow the order, because we don't have that much time to save this person. So before we have to know the main things. So that's why we have some simple history we called ample history. So in ample history, first one, A means we have to check he have any allergies or not. Next, M, he is using any medication or not, or he used any medication, like if any person trying to suicide, so we have to ask what medication, what toxin the consumption, we have to ask everything. Next one, P means we have to know the past medical history or surgical history. Okay, L means what last meal he had. E means events leading to injury. Next we have to do head to toe assessment. In details we have to take head to toe assessment or exam. In head we have to check any scalp or lacerations or there are some and we have to check some any raccoon eyes is there or battle sign is there, because if any person have trauma with constructions, that patient we can see raccoon eyes and battle sign. Okay, this signs is coming because of some vascular problems in brain. Okay, and we have to check first head, then after we have to go to eyes. In eyes we have to check vision and pupil response and hemorrhage. Then after we have to go to ears. In ears or nose, any cerebrospinal fluid is leaking or hemotympanum from blood from ear, if any blood is coming means we have to think about inside some hemorrhage is there. Then after we have to check with neck, any tracheal deviation or jugular venous distension or crepitus or C-spine tenderness we have to check. Then after chest, in chest in rib if any rib fractures are there or seat belt marks or paradoxical movements, these things we have to check. Next, abdomen. In abdomen, like any tenderness or rigidity or distension we have to check. Next, in pelvis, in pelvis. Yeah, we have to stability, we have to check the stability, and any blood is any fractures are there, we have to check. Next, we are going to perineum. In perineum, any lacerations, any hematoma, we have to check with lacerations and hematoma. Next, rectal or vaginal, any rectal tone and bleeding and everything we have to check. Next, in extremities, we have to check any deformities are there or neurovascular status. Next, for back, long roll and inspect the spine, we have to check. Okay, so these are the things. Every time here, mostly if any person have fractures, we have to think about it's open or closed fracture. If after open fracture or closed fracture means, then after we have to do internal and external fixation based on fracture, internal and external fixation of all fractures. Think about DVT prophylaxis also. If any patient coming from, if that patient is going for surgery means, before preparing that patient we have to start with antibiotic prophylaxis. For example, here we are using cefazolin 1 gram, and we have to start with DVT, like deep venous thrombosis prophylaxis, or maybe it can lead to fat embolism syndrome also. So that's why we have to start with heparin 5000 units. If contraindication means, we have to think some alternatives. Okay, so now we are discussing about complications. What are the complications that person can get in trauma patient workup? In complications, mostly we know that is hemorrhage. This is because life-threatening conditions, it may produce signs and symptoms of hypovolemic shock. Next, I already mentioned this thing, fat embolism syndrome. Then after, like venous thrombosis, like DVT. DVT means okay, but it can lead to pulmonary embolism also, or bladder, urethral and bowel injuries also, it may be a complication. Next, some neurological damage, some persistent pain, stiffness, limb weakness in affected extremities. And post-traumatic osteoarthritis. Osteoarthritis of joints with the interarticular fractures. And sepsis. If maybe in open fracture, we can see the sepsis. This is the things. So these things will happen, and some clinical features and investigation and management. In management also primary survey and secondary survey, because in primary survey mostly we have to check with ABCDE. So like, share and subscribe. We will meet in our next video. Take care. Bye bye. Hi friends, how are you all?